Hello everyone. We're continuing for this book we're reading, the Nursing Assistant Care, the Basics. We're going to continue this book for chapter 1. Now we're going to read. Now let's go start with, we're continuing on from chapter 1, the Nursing Assistant in Long-Term Care, because we are now working in the nursing field, so we're going to continue on for chapter 1. The section is describe the care team and the chain of command.
Residents are hurting themselves. The residents have different needs and problems. Healthcare professionals with a wide range of educations and experiences help care for them together. This group is known as the care team. Members of the care team included the following: nursing assistants, NA. The nursing assistants perform assigned tasks such as measuring vital signs, and the nurse assistants also provide or assist the personal care. That's who we are, such as bathing residents, and helping the eliminations needed. Nursing assistants must have at least 75 hours of training. Also, that's what we're doing. We're trying to gain the 75 hours, right? Training, and it states in many states, training exceeds 100 hours.
Yeah, before we could take the CNA. Yeah.
The what we call it. After completing a approval training course, nursing assistants must pass competencies evaluations. Registered nurse (RN) is a long-term care facility.
After working 7 days, and should have to work on our own. It's 12 hours each.
A registered nurse coordinates, manage, and provides skilled nursing skills. For this includes giving special treatments and medications and prescribed by a doctor. A registered nurse also assigned to task the supervisors daily care of residents by nursing assistants. Nope. A registered nurse is a licensed professional who has graduated from a 2 to 4 years nursing programs. Registered nurse, no. They have diplomas or graduate degrees, college degrees. They have passed a national license examinations. Registered nurse may have additional academic degrees or education in specialties areas. Licensed practical nurse, LPN, or licensed vocational nurse, LVN. A licensed practical nurse or licensed vocational nurses give their medications and treatment. And LPN or LVN is a licensed professional who has completed 1 to 2 years of education and has passed a national licensure examinations. Advanced practical practice registered nurse, APRN, and advanced practice registered nurse, sometimes called an advanced practice nurse or P or APN, is registered nurse who has completed training at a postgraduate levels, master's or doctoral. APRNs can make diagnosis and prescribe treatment. Nurses practitioners are one type of APRN. Physicians or doctors, MD or DO. Doctor of osteopathy.
Wait, say that? Osteopathy.
A doctor is a licensed professional who diagnoses diseases or disabilities and prescribes treatments and medications. A doctor has graduates from 4 years medical schools, which they have attended to after receiving a bachelor's degree. Many doctors also attend specialized training programs after medical schools. Many doctors also attend specialized training programs at the medical school. Physician's assistants, PA. Physician's assistants is a licensed professional who diagnoses disease or disabilities and evolve treatment plan, as well as prescribe medications. A PA works until the supervision of a doctor. PAs have received master's degrees and have to pass a national license examinations before they can practice. Physician therapists, PT or DPT. A physician therapist evaluates a personal and develops a treatment plans, increasing movement, improve circulations, promotes healings, reduce pains, preventing disabilities, and regains or maintains mobilities. APT or DPT, doctors or physician therapists give therapies in the forms of heat, cool, massage, ultrasounds, electrical stimulations, exercise to muscles, bones, and joints. The physical therapist has graduated from the doctoral programs after receiving an undergraduate degree. PTs have to pass national licensure examinations before they can practice. Occupational therapists, OT, and occupational therapist helps residents learn to adapt to disabilities, and OT may help train residents to perform activities of daily life living, such as bathing, dressing, and eating. This often involves the use of equipment called assistive devices. The OT evaluates the residents' needs and plans treatment program. Occupational therapists.
Remember these two? These used to help you when they got better?
Earned a master's degree, earned a master's or doctorate degrees. OTs must pass national licensure examinations before they can practice.
Now me?
Yep.
Continue. So we have to go all the way until we have to read all the way until this section to 6.
Hey, go ahead.
So me, we'll start off here.
Yep.
Okay, so speech-language pathologist. A speech-language pathologist, a speech therapist, identifies communication disorders, addresses factors involved in recovery and develops a plan of care to meet goals. And SOP teaches exercise to help residents overcome speech problems, and SOP who also evaluates a person's ability to swallow food and drink. Speech language pathologists have to also earn a master's degree in speech language. Pathology that are licensed and certified to work. Registered dietitian. The registered dietitian also registered dietitian nutritionist assesses the resident's nutritional status and develops treatment plans that improve health and management illness. An RD creates diets to meet residents' special needs and may also supervise the preparation of food and educate people that hold the nutrition need. Registered dietitians also have to have complete a master's degree or a master's degree and must pass a national licensure examination. Medical social worker. This is what we're talking about. Medical social worker, the counselor. This is the one that counsels people if you want to go that route for medical. Medical social worker determines residents' needs and helps them get support services such as counseling, financial assistance. They may also support residents obtain clothing, personal items of family, but not called to visit one. A medical social worker may book appointments and transportation. MSWs also usually have to earn a master's degree in social work. Activities director. Activities director plans activities for residents to help socialize and stay active. These activities are meant to improve and maintain residents' well-being and help them prevent further complications from illness or disability. Game performances in the arts and crafts or some social activities. Activities director may plan or lead. The activities director has usually to earn a bachelor's degree. However, she may also have an associate's degree in qualifying work experience. The activities director may be also called recreational therapist or recreational worker, depending on upon occupation of education or experience. Residents and resident families. The resident is an important member of a care team. Provide a personal-centered care, meaning place them on residents' well-being first by giving her the right to make the right decisions of choice about her own care. The residents plan care, and the resident's family may also be involved in these decisions. The family is a great source of information. They must have residents' preferences, history, diets, habits, and routines. So we stop here. Now we answer this section. All to multiple choice. And the answers are all the ones I've highlighted.
Matching is use each letter only once. Right here?
And here, there, and these are the options you put in there for letters. You just find them in here and match it. It starts off here.
Activities directors. Plans activities for residents. Goes all the way over here.
It stops at M.
Oh, damn. Okay, advanced practice registers nurse.
Want me to just give you the answers or will you look for them?
No, I'll look for it. Advanced practice register nurse.
Okay, so the resident as a care team, as a member of the care team, all members of the care team should focus on the resident. The team revolves around the resident and her condition, goals, priorities, treatment, and progress. Without the resident, there is no care team. A nursing assistant carries out instructions given her by a nurse. The nurse is acting on the instructions of a doctor, the other members of the care team. This is the chain of command. It describes a line of authority and helps make sure the residents get proper health care. So that's the answer right there. Line of authority, chain of command. The chain of command also protects employees and employers from liability. The chain, yes. Liability is a legal term. It means someone could be held responsible for harming someone else. Let's see. For example, the NA harms resident by performing a task. However,
Wait, I'll read this. However, the task was in the care plan. It was done according to the policies and procedures. In this case, the nurse assistant may not be liable or responsible for hurting the residents. However, if the nurse assistant does something not in the care plan that harms a resident, she could be held responsible. For this, why it's important for the team to follow instructions and follow the facilities to have a chain of command. Why should nursing assistants not?
number 16?
Yes.
Is that here?
Why should a nursing assistant not to not assigned to him? What does that mean?
Keep going.
You have to read down this one
You
too?
gotta read all of it.
Administrators, manage non-medical aspects of the facilities, administrators, finances, and coordinator ratio.
That way there's the chain of command.
Yes.
See how we're all the way at the bottom?
Which medical professionals? Yes.
LPN,
Medical
training.
director. Oh, so no, that's not her. I thought Jennifer was this. She's a no, that's not that.
These are the ones that work under us. The nursing
Above us,
supervisors.
medical director reviews and consults the medical aspects for peer coordinating and detecting physicians and the nursing staffs are encouraging.
This is the one that's in charge of the whole facility, huh?
Yes. Director of nursing, manage the nursing staffs at the facilities, assistant directors of nursing.
Once you get a master's degree, these are kind of at the top.
Assistants the DON with the management of nursing staffs. Staffs development coordinator directs the training of employees and the oh wait, is this her? Jennifer?
So yeah.
Minimum data set. Coordinators as residents assess
They're part of management.
yes, a coordinator. Manage the assessments of the residents' needs and delivery of the required care for long-term care facilities, usually especially trainers, nursing supervisors, supervise and support nursing staff of entire facilities or multiple nursing units assisting with residents' cares as needed. Charge nurse, supervise, and supports nurses staff, particularly units experiencing limited numbers of residents. Staff nurses or nurses provides nursing skills as prescribed by the physicians. Nursing assistants performs assistance nursing tasks, assist with routine personal care, and observe and report and changes in residents' conditions and abilities. Nursing assistants must understand that what they can and cannot do. This is so that they do not harm residents or involve themselves in their employees in lawsuits. Some states certify that nursing assistants are qualified to work. However, nursing assistants are not licensed healthcare providers. Everything they do in their jobs is assigned to them by the licensed healthcare professionals. That is why these professionals will show great interest in the nursing assistants do and how they do it. Every state grants the rights to practice various jobs in healthcare through licensure. Examples include like a license to practice nursing, medicine, or physical therapy. Each member of the care teams works within the scope of practice. Scope of practice defines the task of healthcare providers are legally allowed to do according to the state or federal law. Laws and regulations about the nursing assistants can and cannot do vary from state to state. It is important that nursing assistants know which tasks are outside their scopes and practice and not perform them. The care plan is individualized for each resident. It is developed to help achieve the goals of care and meet the residents' specific needs. And list the tasks, services, and treatments the team members, including nursing assistants, must perform. And it states how often these tasks should be performed and how they should be carried out. The care plan also includes the resident's diagnosis and limitations, goals, and interventions such as medications, monitoring, treatments, and nutritional requirements. It also details the needed supplies and equipment, related activities, and specific safety measures. Care planning should involve inputs from the residents and all of their families, as well as from health professionals. Person-centered care places the specialist emphasizes on the importance of the residents' input. The care plan is a guide to help residents be as healthy as possible. It must be followed carefully. And the critical is that nurses make observations and report them to the nurse. Even simple observations can be very important. Information is that nurse assistants collected and the changes that observes help determine how care plans may need to change. Nursing assistants spend a lot of time with residents. They are likely to have valuable information that will help in care planning. If nurse assistants are asked to attend care planning meetings, they should share their observations of residents.
Okay, so for the last two, okay, number 6, define policies, procedures, and professionalism. All facilities have policies and procedures that our staff members are expected to follow. A policy is a course of action that should be taken every time situation occurs. For example, a very basic policy, healthcare information must remain confidential. A procedure is a method or way of doing something. For example, a facility has a procedure for reporting information about residents. The procedure explains what form is complete, how very often to complete it, and whom it may be given. Common policies in long-term care facilities include the following. All resident information must be confidential. HIPAA. Keeping information confidential means not telling anyone about it. This is not only a facility rule, but it's also the law. More information. Remember that video on YouTube? That nurse, the law enforcement came in there and they were trying to arrest her, but she wasn't allowed to give patients.
They're not supposed to. They're
It's HIPAA, but a lot of times law enforcement tries to override it. But at the end of the day, she got released. Remember? More information about confidentiality, including HIPAA, can be found later in the chapter. The care plan must also be followed. Tasks are not able to get the care plan approved by the nurse should not be performed. Nursing assistants should not do tasks that are not included in their job descriptions. Nursing assistants must report important events, changes, or residents to the nurse. Nursing assistants should not disclose their personal problems or with residents or resident families, or else they'll make too much about it, right?
Yep.
Nursing assistants should not take money or gifts from residents. Yep. Did you remember that?
Mm-hmm.
Nurse assistants must be on time because there's a lot of them. Like when you do good to them, sometimes they might want to give stuff to you, but you don't have to accept it.
I know.
If they do try to keep giving us something, do we just tell the nurse about it?
Yes.
Nursing assistants must be on time for work and may be dependable. Employers have policy and procedures for every resident care section. These have been developed for good quality care and protect residents' safety. So us, the first day being there early, I think it was good.
Mm-hmm.
Procedures may seem long and complicated, but every step is important. NAs must be familiar with and always follow policies and procedures. Professional means having to do with work, or personal refers to life outside of a job, such as family, friends, or home life. Professionalism is behaving properly when on the job. It includes dressing appropriately and speaking well. It also includes being on time, completing tasks, reporting to the nurse. For an NA, professionalism means following the care plan, making careful observations, and reporting accurately. Following policies and procedures is an important part of professionalism. Residents, coworkers, and supervisors respect employees who behave professionally. Professionalism helps people keep their jobs. It may also help them earn promotions and raises. A professional relationship with residents includes the following: providing personal care, keeping a positive attitude, doing assigned tasks that are in the care plan that are not in any trained to do so, keeping all residents' information confidential, always be polite, not discussing personal problems.
Now you see personal phones in residence rooms. Yeah, we talked about this too. Or in this residence care area. Not using profanities. Even if the resident does not listen to the resident, calling a resident's mistress, Mrs. and Miss or Miss, and their last names, or by the name of the resident, refers terms such as.
Says we can't call them those things?
Yeah.
Because some of the seniors call them that.
Hi, Mr. Bond.
Yeah,
Just call their name. Such as sweeties, honey, oh, they could feel harassed at home. Or
It's
disrespectful.
weird because some of them call me that too because they don't love. So some call me, hey sweetie, can you do this for me? But you can't call them
I
that.
don't. Just call them by their name. Or disrespectfully should not be used. Using the pronouns in residence prefers she, her, him, they, them. Never giving the acceptance gifts. Always explain care before providing it. Yeah, when I'm
That's
yes.
why our hands get dry.
Yes.
Do you think we should bring
move your,
lotion with us?
yes, I'm gonna move your, I'm gonna
Do
turn
we
your
have
head,
lotion
okay?
in the
Yes.
But do we have one for each of us today?
No.
I guess I'll buy one more.
Yes, we do, but I have the other one, the itching one.
No, I think we should get the one for dry hands.
Yes.
Do we have one for dry hands?
Yes, I think I have
We
one.
need one more.
I still have my old one. Hey, where am I now?
Do we need more or no? We have one for each of us later. We should bring them.
I was explaining care before providing it. Following practice such as hand washing. Oh yeah, I do like happy birthday to
These
you.
two. Happy birthday to you later. Even though we have a lot of them, I'm gonna get one for cutting our fingernails. Do you have one for this?
Oh, they're dirty now. We should
We should cut them.
to test it.
I saw that
One
lady.
still.
She was cutting her fingernails from the desk lamp last time.
Ew.
She's supposed to be in the bathroom, right?
And the residents. As a professional's relationship with the employer includes the following: complete tasks efficiently, always following policies and procedures, documenting and reporting carefully and correctly. Reporting progress with residents or tasks. Reporting anything that keeps the nursing assistants from completing duties. Asking questions when a nurse assistant does not know or understand something.
Always ask questions, right?
Taking directly or feedback without getting upset. Being clean, neatly dressed, and grooming. Always being on time, telling the employer if the nursing assistant cannot report for work. Following the chain of commands, participating in the education programs, and being a positive role in facilities.
Do you feel like this should have been mentioned in orientation? The orientation was not even really anything else.
Nursing assistant must be compassionate. Being compassionate means being caring, concerned, empathetic, and understanding. Demonstrating empathy means identifying with the feelings of others. People who are compassionate understand others' problems. They care about them. Compassionate people are also sympathetic. Showing sympathetic means sharing in the feelings of the difficulties of others. Honest. An honest person tells the truth and can be trusted. Residents need to feel that they can trust those who care for them. The care of teams depends on honesty, planning care. Employers count on truthful records of caregiving and observations made. Tactful. Being tactful means showing sensitivities, and having a sense of the appropriate when dealing with others. Conscientious. People who are conscientious try to do their best. They are guided by the sense of the right and wrong. They are alert, accurate, and responsible. Giving conscientious care means making accurate observations and report following the plans and taking responsibility for one's actions.
What does this mean? Consensuous? Does that mean like? What does that mean?
Conscientious or conscientious? It says right here. It's trying to be
People
that.
between right and wrong.
Yes.
Like doing things good even when no one's watching.
Dependable. Nurses must be able to make and keep commitment.
Oh, it's in here.
They must be at work on time. They must skillfully do tasks, avoid absence. We need this. We're not new here.
But we were the first day, why don't we go
And
early?
help their peers. We need it. Your turn.
Well, you don't think we could still be? Just keep going every day? Oh, but us doing extra days we're not supposed to, isn't that also being dependable?
Yes.
So can we still be dependable as long as we don't do it anymore?
I guess so.
Huh?
Yes.
But didn't we look bad for yesterday?
No.
Huh?
No.
But we're actually really on schedule and we're there. We're no more training and we can't do that stuff no more, huh? Okay. Nursing assistants must be procedures about documenting observations and procedures.
Why do I feel like I'm following the gosh?
Patient. People that are patient do not lose their temper easily. They do not act irritated or complain when things are hard. Residents, patients that are often elderly or maybe sick or in pain. They maybe take a long time to do things. They may become upset. NAs must have patience and do not rush residents or act annoying. Respectful. Being respectful means valuing other people's individuality. This includes their age, religion, culture, feelings, practices, and beliefs. People that are respectful treat others politely and kindly. Unprejudiced. NAs work in people from many different backgrounds. They must give each resident the same quality regardless of age, gender, sexual orientation, gender identity, religion, race, ethnicity, or condition. Proactive. Being proactive means anticipating potential problems and needs before they occur. NA who must pay close attention to residents and their environment are more likely to anticipate needs and prevent problems rather than simply reacting after something occurs. Observing and reporting carefully are key ways to be fully proactive.